The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.
It's the first long weekend of the season, but from tourism to farming, it's not business as usual. Tonight, how the Niagara region is holding up amidst this third wave. Then, from our Ontario hubs, a look at some recent COVID-19 outbreaks in Hamilton. And from the pandemic crisis in India to why being upbeat isn't always helpful, we've got the agendas we can review. I'm Nam Kiwanuka. It's Friday, May 21st, and that's ahead on the agenda. Wineries, orchards, and the breathtaking Niagara Falls. Most long weekends, tourists will be flocking to these attractions, but instead, it's the second year in a row with pandemic restrictions for businesses, farms, and everyone else. How is that affecting the usually lively Niagara region? Let's find out from the Mayor of Niagara Falls, Jim Diodati, who joins us from his city. In Niagara-on-the-Lake, Kai Weens, owner of Kai Weens Family Farm, where he grows peaches. And in Jordan, Ontario, just west of St. Catharines, Suen Staff, president and winemaker at Suen Staff Estate Winery and a director at Ontario Craft Wineries. Hi, everybody.
Hello.
Hi, Nam. Great to be here.
So before the taping started, I had to go upstairs because we're all taping from home and was really strict with my children who are just doing the same thing they were doing a few minutes ago. But thank you so much for joining us for this conversation. And just kind of to set the table, I wanted to go through some numbers. The regional municipality of Niagara is home to nearly 500,000 people. It normally welcomes more than 13 million tourists a year, about a quarter from the US. Tourism generates $2.4 billion for the local economy annually and employs 40,000 people. But the Canada-US border, as we all know, has been closed since March 2020 to non-essential travel. And when we talk about agriculture and wine, Niagara grows cash crop, dairy, fruits, think peaches, cherries, pears, vegetables, and flowers. It accounts for 80% of Canada's total grape and wine production. It's home to about 100 wineries. Taken together, Niagara's 1,827 farms contribute more than $1.4 billion and 19,892 jobs to Niagara's economy. Sadly, 44 farms in Niagara have had COVID outbreaks with 244 cases total. You know, we are in the second year of this pandemic, and Mayor, I wanted to start with you. Briefly, from where you stand in Niagara, how stressful has more than a year of this pandemic been?
Well, Nam, it's been very stressful. I guess devastating would probably be the word. Obviously, in Niagara Falls, we're Canada's #1 leisure destination, and tourism is very, very important. And you mentioned earlier, 40,000 people count on tourism to put food on the table. And the taps to tourism have been shut off, the borders have been closed, and it's put us in a very, very difficult place financially, also psychologically. You know, when you have your routines disrupted the way they have been, it really messes with you. So we're very hopeful that things are going to turn around this summer. We're going to have more of a normal summer where we can have people coming again in a safe way and we can start the engines revving once again in tourism.
And Suen, you've called this, quote, an absolute emotional and financial roller coaster. For you personally, has there been, a moment this year plus where you've thought to yourself that maybe after 200 years of my family on this property, I'm not sure I'm going to survive this?
This has been tough. It's been very, very tough because what we do with Small One is we love to entertain. We love people coming to the property. We love telling our story about who we are, how we got here, how we grow grapes, how we make wine, and selling the wine bottle by bottle. And we know when tourists show up that 70% of them purchase wine. So it's very powerful when people come to visit. And to look out in the driveway and to see not even a car there is so disheartening. We're doing not what we do best. We were a sector that was in trouble before COVID, and COVID just exacerbated the challenges that small and medium-sized wineries have been facing in the province of Ontario.
We'll talk more about that in a second. And Kai, I wanted to bring you in as well. At the beginning of the pandemic, there was a lot of fear around keeping healthy and being healthy and not getting sick. A year into this, how stressful has this year been on your family? And at any point, would you maybe now be more fearful for your financial well-being as opposed to being fearful for maybe getting COVID?
So yeah, so for us, it's seasonal agriculture worker program. It's offshore. So getting these guys last year to come in when there was a shutdown, all the airports were closed, trying to get these people in. We have to get our pruning done. Peaches need to be pruned every year, and they need to be done by June 1st. We need to get our thinning done. So the stress was getting these folks to come in, and then they came in healthy. They came in excited to work.
And when you say folks, you're talking about the temporary workers that work on your farm, right?
Temporary workers. Yeah, it was my moral responsibility to get these guys back home healthy. So that's an enormous amount of stress to put on anybody. We have 47 people. And to get these folks to come in, that they would come in, remember that they would come in, and then to get them home. So was it stressful? It's enormously stressful. We actually talked about closing down last year. We started out late. We couldn't get any employees. We had people, my high school friends, 45 years ago, people calling me, we'll come and help. We'll do it. What do you need? But it was so to the point, my wife and I were looking at it and saying, let's just close. We're done. We'll rent it out. We'll sell it out. We'll do whatever we have to do, but we're done. My wife gave me permission to say she had panic attacks. She couldn't breathe. She was in the hospital. She couldn't move forward. Has it gotten better? It has, because looking back last year, the consumer of peaches stepped up. They said, we're not going to leave you alone. We're going to buy your fruit. We're going to buy your peaches. We're going to buy your plums. You're going to buy your pears. We were short on product. They came out and they bought it, but we didn't know if they were going to buy it. We didn't know if they were going to go to the grocery stores. We didn't know. This year, and then all the government agencies, but this year, walking into this season, it's been a lot better for us because we know the consumer is going to step up. They're going to help us. They're loyal to us. We're loyal to them. They're loyal to us. They're going to step up, and we love that. We don't take that for granted. Our guys, our people.
I'm sorry to hear that about your wife. I was just going to say, it must be such, a reassuring feeling because at the beginning of the pandemic, none of us knew what was coming next, but to have been able to weather that storm, so to speak, and to see your community and your customers, show up for you, what has that meant for you?
It's emotional. If you can think that I haven't seen some of my friends from high school in 35, 40 years, and on Facebook, on phone calls, they're saying, hey, you can't get your guys in? We don't know how to prune. We'll put sticks on the ground for you. We're there for you. We're off work anyway. We'll come out. And we were getting a lot of that. We're getting a lot of community support. How can we help? And I mean, that's amazing. That tells you what, if there's a positive in COVID, it's made people nice. It's made people generous. It's heartwarming. At first you're scared. What if something happens? Now now it's, how can we help you? What can we do? How can we rally around you? That's an amazing feeling.
That is an amazing feeling, truly, because I think we all need the support that we can get. And Mayor, you were on our show last summer, and cases back then in the US were skyrocketing. You said it was like living next to Chernobyl. Now nearly 40% of Americans are fully vaccinated. Do you think that the Canada-US border should open now?
Well, I think we need to have the plan now that the U.S. has definitely done a 180, where they were much worse and now they're better. I mean, they've got lower case count, they've got higher vaccination rates, and they've got surplus vaccines. So I know Senator Chuck Schumer, we've had Congress people, we've had governors, we've got a lot of people that want to see the border open. We know it's going to open. We just don't know when and how. So I've been pressing the federal government to give us the metrics, the targets, the benchmarks on how we open safely. And if that means a vaccine passport in the short term, I said before, it's not a big deal. When I bring my dog across the border, I have to show his vaccination papers for rabies. And when I travel to other countries, I have to be vaccinated as well. It's not a big deal, temporarily anyway. And 25% of the tourists that come to Niagara come from the US, and they represent 50% of the revenue. So it matters in a big way. So yes, we need to open up. Yes, we need to have a plan on when and how, so that we'll know how to hit the targets. How do you hit a target when you don't know where it is? So we definitely want to have that discussion. We definitely want to have a plan. And I know the Americans are very supportive. As a matter of fact, there's a strong push right now for them to share their vaccines along the border. They're already doing it in North Dakota, Alaska, Montana, Washington. And now there's discussion with Michigan and New York to share the cross-border vaccines. And we've seen, I mentioned the governor and the senator, also Congressman Brian Higgins, tweeted yesterday that they're willing to do this to help us. So if we could just get the two federal governments talking, sharing. Here in the US, they're throwing vaccines out, unused vaccines. And here we've got people very willing to go get their vaccines. So I think the solution of sharing the vaccines and opening the border are going to tie together.
Yes. Well, one thing that I've been reading about is in the US, people getting vaccines, it's actually kind of plateaued. They're actually having like a lottery. If you do get your vaccine, then you can play a certain lottery, because people have stopped getting the vaccines. They might be there in abundance, but the vaccinations have plateaued. And Premier Ford has said over the past few weeks that the border, the Canada-US border, is to blame for this third wave. Is he right?
Well, I typically try to stay out of the squabbling. For me, I'm focused on the finish line, and I'm focused on getting out of this. I'm the eternal optimist. I'll find the silver lining in any gray cloud. And I mean, I think we all agree we're trying to get out of this. Maybe we disagree on how we get there and how we got here, but I think we're all focused and definitely agree that getting out is paramount to our success mentally, financially, emotionally, and in every way possible. So my focus right now is let's get this thing done. Let's get it behind us. I know the US, you're right. They're having vaccine hesitancy. They've had to create incentives. And here it's the opposite. Here, people, it's like when I got my first shot, people around me, some people were crying. It was like they just won the lottery. They were so relieved and so happy. And even after only one shot, your protection rate is extremely high. And then the second one, of course, will be a booster. So I'm glad to see people here still happy to get it and move forward. And again, I know there's a certain level of hesitancy here as well, but here there's a lot more uptake. Our take rate's a lot higher. And the good news is we're going to get out of this much quicker if more people can get their vaccines.
The Prime Minister has said, with a one-dose summer, things would look much better than they did even 3 months ago. In the meantime, though, Sue-Ann, how devastating has more than a year without tourists been on small and medium-sized wineries in Niagara?
Right. It has been particularly devastating that like 1 in 3 wineries believe that they may not be able to weather this storm. 60% of wineries have laid people off. 30% are not sure they'll be able to meet payroll, and concerned about bad debt from restaurants and into our banks. So it's trying. For small wineries, we know that about 75% of their revenue comes from wine sold in their retail shop. So where are those people coming from to purchase in the retail shop? Those are mainly tourists. They're either day trippers or staycationers. They're international travelers. They're coming in from the States. And when we take away the international travelers, the US travelers, and just leave us with only who is around here in Ontario, it really gets thin. And, really, truly the great experience of purchasing Ontario wine is coming to the wineries and having that feel and tasting the wine and talking to the owners and the winemakers. That's we really had to reinvent ourselves almost every week and really take advantage of our databases, our social media channels, go strong on online sales. And that all has kept the lights on for those that were lucky enough to have that type of presence in the marketplace beforehand, and in the marketing world, I'd say. So it's feeling like we're getting to the end, and yet I've never been more tired. And yet now is the time where I have to turn the afterburners on, because it's looking hopeful that we'll be opening up. We're ready to welcome the 2.4 million visitors that typically come to wine country a year, and let's do it. So.
I think some people might not understand why you're struggling, because you mentioned there's this perception that, well, it's not a perception. Studies have shown that people are drinking more, and you mentioned the online wine sales, and the Ontario government has allowed restaurants and bars to sell alcohol with food deliveries, and I'm imagining that's helped a little bit to some people. But has it been enough to mean wineries haven't had to lay off many workers?
Right, definitely the frontline staff are the staff that have been the hardest hit through this pandemic. That marketing and sales staff were basically have been sidelined for an entire year. What COVID has done as well is really highlighted the foundational problems that are in the alcohol business in Ontario. So we have not been in this together, because the larger wineries have really great shelf presence. They have points for sale, avenues to retail sales that small wineries just don't have, such as like a strong presence in the LCBO, their own retail shops they've control over. Well, we have our single points of sale on our property. We know through COVID as well, the consumer has gravitated towards larger format purchasing, such as bag in the box and 1.5 liter bottles. They've also downgraded their purchases and going to brands that have history and and there's a sense of comfort, I guess, when you're buying from a large brand. When you're a small brand in a huge monopoly like the LCBO, your brand just kind of languishes on the shelf there. So yes, people have been drinking potentially more, but I think we've also been drinking only like every day at home with dinner, and drinking wines that are probably not from smaller wineries. I'm speaking in circles here, because the Go Local movement has never been stronger. Just, kind of circling back to comments that Kai said about how, people really focused on helping out the local economy. And that's where our online sales really, really helped. But it did not get us out of the hole that we've created financially from even before COVID. And then COVID has just made that hole deeper.
And Kai, I want to bring you back into this, because early in the pandemic, people, peach farmers like yourself were probably worried about, you mentioned you were worried about Ontarians not buying your product anymore. I think we went through this phase where people were wiping clean their groceries. And you mentioned that you had a moral obligation to make sure that the people who work for you got back home safely. The rules change a lot, and they've been changing a lot. How hectic and confusing has it been for you to get your workers to and from Canada, and then making sure that they're safe on the farm and not contracting COVID-19?
What's happened is since we're getting a handle on COVID, we're realizing that there's better and better rules associated with travel and things like that. So we have the 72-hour prior to flight. We have the airport test. Then we have now it's 8-day, but at that time 10-day for us was 10-day test. So we know that our employees are safe. We can supply them with groceries, things like that. We can do all that. So in that way, we have, because we're already a food safe organization, we're audited by Canada Gap auditing. So we're already familiar with masks, gloves. We have sanitation depots, hand sanitizers throughout the orchards. We have them in our buildings. We have them in our vehicles. So keeping safe isn't hard if we're responsible. If each individual person is responsible, then it's not hard. It's if we get the outside influence, and we haven't had that. We've been able to stay as a bubble. Last year we stayed as a bubble. No one had had the illness at all. This year, one of our employees did turn positive. He was asymptomatic, I guess that's the term. And I'll tell you, that scared us. That was an enormous fear. But what happened was all the government agencies, so there's a list of government agencies, and I turned to the Tender Fruit Growers Association, and Sarah Marshall, who's just a queen. She's just fantastic. She said, these are the things you have to do, and listed all the people that I had to, and I'm going, Ministry of Labor, WSIB, Public Health, Service Canada. I don't want to poke the bear. Why would I want to talk to these people? When I did, every one of them said, how can we help you? You're not alone. You're not doing this by yourself. We're going to do lots of paper. We're going to throw lots of paperwork at you, but we're going to help you with it. We're going to walk you through it all. And when this is done, you're going to look back and say, this wasn't so bad. And it wasn't. We walked through it. He was asymptomatic, so it wasn't a problem. And he's back at work. But the government agencies walked us through it. Not at any time did they say, you made a mistake. If I made a mistake, they said, oh, let me help you with this. So it was not a pleasurable thing. There's a lot of paperwork, but we walked through it. Everybody was helping us.
I just wanted to follow up with that, that you were able to walk through it and nobody got hurt. But, during this pandemic, we have heard about temporary foreign workers dying here in Ontario from COVID-19 because of unsafe conditions on farms. When you heard that, what was your reaction?
We tightened up. We said, how could that happen? These guys are coming in healthy. What just happened here? How could that happen? So what we did is we limited outside access. So what we said is we came to our employees and said, look, this is what's happening out there. We got in front of it and we said, you might be a social person, but your co-mates may not be. They might be afraid. They might be insecure. So what we're going to do is we're going to start respecting each other. So if you were a social butterfly, we're going to ask you to pull back on that idea just for this year. It's 20 weeks. Pull back. And we did, and they did. And so we did, as my wife did it right away in March before anybody came. We had this table outside of our house for deliveries, a red side, a blue side, red side and a green side. So it comes red side, we spray it down, green side, bring it in the next day. Every one of the houses took that. They all embraced that. And so when deliveries were made, it went on one side, it was sanitized, went to the other side, went into the house. So we all took ownership of making sure we were safe, and we were. And at the end of the season, a couple of people were maybe a little upset because they didn't have that socialization, but I got a lot of thank yous. It said, thanks for keeping us safe. It wasn't fun, but thanks for keeping us safe, because I had to hold back some people who wanted to be social. You have to remember, these people have been here for maybe 20 years, 25 years. I've had employees who have pensioned out for me. And they have a life here. They have a social life here. They have a real life here. They're here for 5-6 months. Now to say, listen, I know you want to do that, but we've got other people here in our housing community that are a little insecure. So we're going to back off on that. My wife and I haven't really left the house. I have a coffee club that I haven't seen in over a year. Every morning I see these same 20 guys. I haven't seen them yet.
Yeah, it's been really hard because not being able to see people. And I think this summer, a lot has been placed on what's going to happen this summer because we all collectively want to avoid a fourth wave. And Mayor, just yesterday, Premier Ford released his reopening plan and what's to come over the next few months. Cases today are on the decline in Ontario. How are you feeling about this summer? Are you optimistic?
Yes. It's one thing I'll say, in tourism, resilience is part of our DNA, and we've been through a lot. H1N1, SARS, mad cow, 9/11, currency fluctuations, bad weather summers, and we bounce back because we have to. We have no choice. Like Plato said, necessity is the mother of invention. And also, like Kai mentioned, we came up with a bunch of protocols. We went way above and beyond what were asked of us by the province. And we brought in epidemiologists and created systems and protocols. And to this day, not one documented confirmed case of transmission between a guest to Niagara and a hospitality worker. And how do we do that? We created programs like SafeToPlay.ca and SafeToStay.ca. And we started Crush the Curve, where we had ambassadors going up and down all the tourist areas and reminding people, keep your distance, wear your mask, sanitize. I got to say, everybody, as Kai mentioned, we all came together because we understood this is for all of our futures. And we knew it was short-term pain for long-term gain. And in Niagara here, I'm going to tell you something. We circle the wagons. We offer everything. We got amazing wineries and fresh fruit and beaches and casinos and restaurants and golf courses and cross-border. And we got it all. The quality of life here is phenomenal. We love it. We protect it. And we know this summer will be the time we can start rolling out the red carpet again and invite people back to the buffet of fun and excitement.
The buffet of fun and excitement. I love that. Sue-Ann, when I asked the mayor about this border question, he said we try to look at the silver linings. The government has announced a plan on how we can reopen safely. If by any chance the premier is watching this, could something along the lines of maybe, yes, the border with Canada and the US might stay closed, but maybe this is an opportunity to encourage intra-provincial travel and maybe travel to your region and for people to explore that part of the province in a safe way?
We know wine country is ready. We already have our own safe travel plans and protocols how to deal with the public when they arrive. So we're set, ready to go when the lights are able to be turned on, and of course in due time. We just want to advocate that we know that when tourists come to wine region that they have a great experience. We know that every dollar that they spend stays within the province of Ontario. It stays here to create more jobs directly and indirectly. A lot of jobs here in rural Ontario as well. We're buying equipment. We're improving the land. We're keeping the green belts green, and we're a lot of our wineries are on spots that are protected between the Niagara Escarpment Commission and Greenbelt, etc. So we're locked into agriculture, and so we need whatever support it is that we can get. These are massive investments. Like, we're not the little knick-knack store on a corner. These are like $5 and $10 and $20 million operations that employ anywhere from 5 to 100 people, and like this is it's been a really tough time to make sure we can keep everybody safe and keep our employees engaged. When those lights turn on, it's a huge change to get everybody back, get them trained, and get it going again. So I guess the premier is listening right now. He knows what I want to say because he's heard me say it before. We need fundamental tax changes in the wine world. We need the full elimination of the 6.1% beer and wine fee that's absolutely crippled small and medium-sized wineries for decades. We also need permanent tax relief for wines that are sold at the LCBO. Right now, Ontario wine, when it's sold in the LCBO, it's the equivalent of our wines going across the Queenston-Lewiston border and coming right back in. There's absolutely not one bit of preferential treatment. So we need at least a 30 to 35% permanent tax relief for wines that are sold in the LCBO. And we also need...
I'm so sorry. I'm so sorry to interrupt you because I'm just seeing the warning time, and I want to get Kai in for the last 30 seconds. Kai, you have 30 seconds, so I'm not going to put too much pressure on you. But you've said that my peaches look at you and say, you got to take a bite out of me. What makes Niagara peaches the best peaches in the world? And you only have 30 seconds. No pressure.
Yeah. Our microclimate, we've got Lake Ontario and we've got the escarpment. So it's a microclimate of humidity, and the soils have a certain something that the flavor, the sugar, I'm telling you, if you don't know, and I know you do know because we sell the peaches, I'll tell you, you can't beat the flavor. And I've been all over. I've eaten peaches all over, fresh peaches off other trees. And sorry for stealing. But I'm telling you, we can grow the best strawberries, the best cherries. They may not, and our peaches, they rival in color, in size, and surpass in flavor. But when you look at a Vivid Peach, Starfire, I shouldn't tell you names because you're going to look for them, but I'm telling you, Starfire, Blazing Star, Vivid, they call to you. It's like a good, red, delicious apple. It just grabs you and says, take a bite. You're going to enjoy this.
Well, I'm glad I asked that question. I'm probably going to get into trouble for running over.
Lay's potato chips. You'll eat one. You want another one.
Yeah, just have one. Thank you all so very much. And best wishes in the next coming few months, and enjoy this great, beautiful long weekend. Thank you so much for your time. We appreciate your insights tonight.
Thanks, Nam.
Thank you.
Thank you.
During the third wave of COVID-19, Hamilton, Ontario has seen at least 3 outbreaks in apartment towers. Justin Chandler covers the Hamilton-Niagara region for Ontario Hubs, and he joins us from the Hammer on what's driving the spread in those settings. Good to see you, Justin.
Hi, Jan. Thanks.
All right, so let's get to it. Can you describe the situation in Hamilton when it comes to apartment outbreaks specifically?
Well, until very recently, May 4th to be exact, we didn't actually know that there were any apartment outbreaks in Hamilton. Of course, cases happened in apartments, they happen everywhere, so there was always the assumption that they could happen. But it wasn't until that day that Hamilton Public Health identified an outbreak at the Rebecca Towers. And the following week, they identified 2 more, one at the Village Apartments and one at the Wellington Place Apartments. So now we've got 3 apartment outbreaks in the city. And as of us recording this, over 220 people have been infected and 1 person has died in these outbreaks.
Now, it seems pretty obvious with apartment buildings when you compare it to a standalone home, the challenges in isolating and physical distancing. But what are public health officials saying about these outbreaks? What do they believe is attributed to it?
Well, ever since the start with the Rebecca Towers case, Hamilton Public Health has been consistent in saying that they believe that socialization between residents is the cause of this. And they've said that that's not necessarily just people going over for a gab, but maybe people going to deliver groceries to somebody or trying to help someone out with some childcare. But the residents, they say that this can't explain everything. They disagree that that's what they think has been causing this. And they believe that public health needs to look at 2 other places. The first of those that they identify is that only one of the elevators in the building has been working for the past several months. So there have been people in this 17-story building, everyone's been using one elevator, and they say that that's led to crowding. And another thing that tenants have said is that they worry about airflow. They believe that there's inadequate ventilation, which public health has not agreed with, but is getting the building to inspect. And they say that potentially COVID-19 gets airborne and transmits between units. As far as the other 2 buildings, we're not really sure yet, but there are investigations taking place.
Okay, so with respect to ventilation, I actually want to pull up a clip of David Elfstrom, an energy engineer, speaking to Hamilton City Council earlier this week.
Units are not sealed, and so air does move between units. And we know this from many indoor air quality studies, especially in the older buildings. So point 3, these contaminants build up, they spread to other units. Stale, contaminated air, potentially with infectious particles, is exhausted from the kitchen and the bathrooms. It's supposed to be. Makeup air should be supplied from the corridors under the door. If the exhaust is weak, those contaminants build up, and it makes it very high likelihood that there will be transmission within the particular unit from person to person.
Has there been any proof that the problems at Rebecca Towers is due to poor, outdated ventilation systems? I mean, just watching that clip, I imagine tenants may start, would be concerned hearing things like that.
Oh, well, certainly. I mean, I'm a tenant, and as soon as I interviewed David for my piece, I went around and I checked all the ventilation in my apartment to make sure that air was flowing where it's supposed to flow. And I think a lot of people are concerned about this. But it's something where there haven't really been identified cases in Ontario, at least not according to Public Health Ontario. And Hamilton Public Health has also said that they've not been able to identify any cases where this has happened. However, Hamilton's Medical Officer of Health, Dr. Richardson, noted that there are cases where it has happened, and we know that COVID is airborne and it's a possibility. She also said it's hard to identify. So that leaves some questions. There's also research by Public Health Ontario and by the National Collaborating Centre for Environmental Health, which show that airflow transmission is possible, and good heating, ventilation, air conditioning systems can help prevent any sort of COVID transmission by keeping air moving. They also say things like opening your windows can help. So we know that ventilation is important. We know that airflow is a possibility. It's just hard to say exactly where it's happened. But I mean, even if you talk to an epidemiologist like Dr. Isaac Bogoch, he's an infectious diseases physician and a member of the vaccine task force. He says if you're looking at an outbreak in an apartment building, you should be looking at human behavior and you should be looking at air. So it keeps coming up. It's just not something that anyone's been able to put their finger on and definitively say this is where it's happened. But there are still investigations happening.
Now, public health units have been dealing with apartment outbreaks elsewhere in Ontario. Have they learned anything from dealing with those specific situations?
Well, I talked to public health in North Bay, Parry Sound, and they're currently doing an investigation. So it's not done yet, but they said that some of the things that they learned so far have been that it's important when dealing with an outbreak, as they were back in March, to ensure that the building management is being consulted, residents are being consulted. They said it's important to look at different aspects like movement in the building, airflow in the building, where people are congregating, how they're moving around. And also they said that vaccines are something that can be helpful. And if possible, it can be good to bring those to people in the affected building.
Now, Justin, you spoke to Emily Power, a Rebecca Towers Tenant Committee member, and she had this to say at the Hamilton City Council meeting on May 17th. Working class people are the backbone of the city. We are the people who have sustained the city through this terrible pandemic, doing important work. And we feel that we deserve to have the vaccine brought to us to save our lives. What's interesting to note is that these buildings are not in provincially or municipally designated hotspots or high priority areas. So is there a plan now to get residents vaccinated?
Yes. So public health has been working to bring homebound residents, so people who they say can't get out to go to a vaccination clinic for various reasons, to bring them their vaccines. They say that they have vaccine ambassadors working at the buildings to try to encourage people to get vaccines and to let them know about clinics. And they've also worked to designate spots at mass vaccination clinics nearby, so that people can come and they'll have, let's say, an hour on a Wednesday night or something like that, so that people from these affected buildings will have a dedicated time that they can go and make sure that they get their shots. Now, the tenant committee in Rebecca Towers, for example, says that that's not enough. I know in the village apartments, they've also been pushing to try to get on-site vaccination clinics, but public health says that that's very resource intensive and it's not something that they want to do.
I am curious to know, during this situation, during this outbreak, have people left the building? Were there concerns that, hey, you know what, this is not being managed well, that I need to get out?
I'm not sure about that. I don't know if it's caused people to flee. I know that people are definitely worried about it. And it's really the whole neighborhood is concerned. Like Emily Power, for example, doesn't live in the Rebecca Towers, but she's someone in the neighborhood and she's trying to work with people in the community there. And as you said, this is not a designated hotspot. And the Hamilton Spectator has found that it's actually the area in the city with the second lowest vaccination rate. There's a high preponderance of essential workers, public health has noted. So really, people in that whole community are the people who are helping keep our warehouses running, for example. They're people who are working to keep society running. And I think that whether or not they want to now leave their apartments, they definitely feel like, you know, they've been working hard, they've been trying to do their best, and I think a lot of them perhaps feel like society's been letting them down.
Justin, I want to thank you so much for this. We'll see you on the next one.
The agenda this week looked at whether Ontario can afford its proposed healthcare spending and why positivity isn't always a good thing. The agenda this week in review begins with the COVID-19 crisis in India.
Barca, first and foremost, our condolences on your loss. This must obviously be a horrible time for you and your family, and we're hoping that by sharing the story of your father's circumstances, we can help to tell India's story and have everybody learn a bit more about what's going on and the gravity of the crisis in India. Can we start just by having you tell us what did happen to your dad?
Thank you, Steve. And yes, I think one of the reasons that I do want to talk about my father is because in the telling of his story, I'm also telling the story of my country. The irony, of course, is that as a journalist, I've been reporting nothing but the COVID pandemic for the last 15 months from across India. And to quite literally become the story that I had reported has been surreal and devastating and heartbreaking. My dad, like everybody else, started off with a mild infection, and the doctors thought he could be managed at home. And for 1 week, he seemed to be doing absolutely okay. In fact, I was out in the hinterland reporting the COVID crisis, even as my father had tested positive, because the doctors felt that it was manageable and I didn't need to worry. But after a week, his situation just nosedived. He had other comorbidities. He was diabetic. He was in his early 80s. By the way, he'd had one jab. The reason this is relevant is I'm haunted by questions about, the if and when of India's vaccine rollout. Had those vaccines rolled out quicker, had I managed to get him 2 jabs in time, maybe he'd still be alive today. But what happened was this, that when the doctors finally said, look, you've got to get him to hospital, the health system here has been overrun. It's been overstretched. Every resource is wanting, even for people with relative privilege and access to resources like me. So I organized a private ambulance thinking it would be quicker to rush him to hospital. And I made what I think is possibly a fatal error. What arrived was actually a rickety old car repurposed as an ambulance. It had no paramedics. It had a crew of 1, which was the driver, and it had a single oxygen cylinder at the back. I panicked a bit at seeing this, and I asked the driver repeatedly, does your cylinder work? And he assured me that it did. So because I was panicked and wanting to get my dad in time to the hospital, and the hospital ambulance would have taken another few hours because that's how overburdened the hospital was, I put my dad onto the back of the seat. There wasn't even a stretcher. I jumped onto the front seat and I rode with him, by the way, through traffic snarls. One of the big gaps in our cities is we still don't have a green corridor for ambulances. And by the time we reached hospital, unfortunately, the cylinder had not administered the high flow oxygen in the way that it should have, and his oxygen levels plummeted. He had to be taken straight into ICU, and he never made it back. He lasted 5 days, and 2 of those were on ventilator. What I want to say is, through all my heartbreak, through all the trauma of that ambulance, through the fact that I will be shadowed by guilt as to why I took that non-ambulance ambulance, my father had a fighting chance at living. He got excellent medical care when he finally got it. But most people I have been reporting on did not even get into the insides of hospitals. Or if they got into the insides of hospitals, they died not from COVID, but from oxygen supply running out to these hospitals because oxygen ran short. So I am aware in this moment of personal heartbreak, and it's a strange thing to say, that my father was luckier than most. He didn't make it alive, so he was deeply unlucky. But in having that chance at living, he had a chance that hundreds of thousands of Indians did not or have not been getting.
I'm really trying hard when I ask this question not to bring politics into it, but you can't help but notice that there are television commercials that have been taken out by the Ontario Progressive Conservative Party, Doug Ford's party, obviously, Premier Ford's party, urging Justin Trudeau, the Prime Minister, to tighten up the borders because he says, in his view, there are too many cases. Well, what's the line he used? COVID's it's not swimming over here by itself, is the line he uses. It comes on airplanes. Now, you're an infectious disease specialist. Do we have a problem with a porous border and, say, flights from India bringing COVID-19 to Canada, to Ontario at the moment?
Any kind of flight coming into Canada or any international flight allows viruses to spread. So it's not just flights coming into India, it's other parts of the world that have hotspots, but also flights often don't come directly from India. They come through Europe, or they might come through Africa. So unless you're willing to stop all international travel, which is what we should be doing, stopping all non-essential travel, it's hard to make a difference with just stopping flights to India. And most of the transmission occurring in Ontario is really people who are essential workers, people who are being exposed to COVID through the work that they're doing. And so we need to address that. We need to address unpaid, paid sick leave. Those are issues that, and trying to keep sick people home, those are the issues that we need to address in Ontario. It's not so much the borders, but again, if we're closing, we should be closing all international flights, basically all non-essential flights from around the world, not specifically targeting India.
the reason that these cliches exist, like the whole, keep a stiff upper lip and always look on the bright side. And, coming from a British background, the whole stiff upper lip thing was deeply ingrained in my psychology. So it was always, you have to be strong, you have to be positive. And also that idea that just no one wants to be around someone who's negative all the time. And I didn't want to feel like people would think that I was complaining, because, no matter how bad it was, there's always someone who has it worse. So there's also that we're always constantly thinking about how we're being perceived by others. And I think that is also part of it.
I should ask you, how are you now anyway?
I'm doing great. Thank you.
Okay, good. Glad to hear. Peter, put us into a common scenario where, let's say a typical married couple, one of them is a very sort of normally chipper, upbeat person. The other person is, just kind of walks around with a cloud over their head all the time. You want to give some advice on how to handle that situation?
Yeah. In that kind of case where one person is more toxically positive and not listening to the other partner, that person who's more upset may be feeling invalidated and dismissed whenever communicating about negative things. So if that pattern continues, that person would feel more unheard and discouraged and may share less and less of those experiences over time. So the problem is that this can build up slowly over time in a relationship and lead to emotional detachment and serious conflict. So when people are noticing this happening, I think it's really important to improve the emotional communication, try to recognize when this is happening and try to listen better and really get into the other person's experience rather than trying to replace it with your own.
That's the key, June? Listen more, talk less?
Absolutely. And to kind of follow up on that point, we found that people who have what we call high levels of dispositional positive emotion, people that tend to experience positivity across context, this may actually cause them trouble in relationships where a partner's sharing something negative with you. Imagine your partner has come home from work and had a stressful day or received some bad news about their health. We find that those who continue to have these high levels of positive emotion in those relationship contexts end up misunderstanding their partner. And that can pose obvious concerns for relationship satisfaction and the ability to really connect with others and support them.
Sydney, you researched this for your piece, obviously, for Chatelaine. How far back does this, what do you want to call it, positivity trap, how far back into history does this actually go?
It's funny, it's not a new phenomenon, that's for sure. In one of my sources that I interviewed sort of compared to what we do now on Instagram to, back in 18th century portraits. If you're walking through an art gallery, you can see, a man with his dog and his kids and his wife, and everybody's beautifully dressed. And, as I noted in my article, you don't see, the outdoor plumbing and the smallpox scars. Like there's this whole idea of creating this fake persona, this artifice of positivity and affluence and happiness. If you go through any Instagram feed, you won't see people most of the time where it's very curated, and it's a whole there's a lot of artifice in this world that we create online for others to see. And I think that we do that ourselves as well, and it goes back for forever.
I don't necessarily want you to throw any of your family or relatives under the bus here, but I am going to ask this question anyway. I mean, you mentioned a few moments ago you got this sort of British stiff upper lip thing going on in your family. Did you have it out with any of your family members when you were going through what you were going through?
I just was being, I remember my mom always saying to me, you're always so positive. You're always so upbeat about everything. And I even felt hesitant to tell my mom, who I'm very close to, how I was feeling. And she's always been very strong growing up. Even when I never knew when times were bad, even when they were bad, because she hid everything. And so I think that has sort of, I've inherited that. And I never really had it out with anybody. I just found myself doing the same thing with my kids and my family.
It's just occurred to me, we should have invited your mom to come on the show too and get her side of the story, just in case the daughter
She would have killed me.
Yeah, well, let's not have any of that. Okay, June, pick up the story from this angle. Social media, of course, has a profound impact on everything today, usually negative. I shouldn't say that, but it feels like it so much of the time. What has social media done to the topic we're discussing tonight?
I mean, I think social media is complex, right? Because as you said, there's a duality to it. There are ways that it, especially in times of physical separation, can give us some sense of being connected to others. But I think the dark side or downside of it when it comes to positivity is creating unrealistic standards for how we ought or should be feeling right now. People are posting images of smiling with their friends or their family, or going out and doing fun things, winning awards, humble bragging, all these sorts of things. And it creates what we call a kind of discord because we're engaging in social comparison. And those social media images are setting up standards for how we think we should be feeling. And that's not always positive.
The diagnostic testing backlog now facing Ontario patients. And for those listening on podcast, I'll go into some detail here. If we go back to the beginning of the pandemic, that's March 2020, you can see on this chart there is very little backlog at all to speak of. But then as the pandemic takes root, the numbers really go up and up and up a lot. And today we're looking at a non-emergent diagnostic procedure backlog of 1.6 million procedures. And if the current rate continues, the FAO has got that estimated by September to be nearly 2.5 million backlogged procedures, which the FAO estimates could take 3.5 years at current spending rates to clear. That clearly is not acceptable, I would assume, to the people of Ontario. But Andre, let's just remind everybody what the FAO is talking about when they're referring to this kind of a backlog. The services that this would include, non-urgent diagnostic services, means what?
Well, mostly surgeries, so not urgent surgeries, but elective surgeries. So there have been, as the report says, millions of procedures delayed, put off, and we're going to have to catch up at some point. And the question is, how do we do it? We can't magically add doctors and nurses. Operating rooms were already full. We already had shortages of staffing. So this is a problem. And these numbers really underscore just how severe the problem is. But the solution is a lot less obvious.
And this chart actually is not even elective surgeries. This is just the diagnostic procedures, the biopsies and that kind of thing, which I mean, if you're somebody waiting for a diagnostic procedure right now, Andre, this can't give you a lot of comfort, I presume.
No, this is essentially, I should have stated that more clearly, the prep before the surgery. You have to be diagnosed, etc. So waiting for scans and things, no, it's a time where people are very worried. They don't know the results. They don't know what's going to happen. And this was a problem before COVID. We didn't have a big backlog, but it was sort of always trying to catch up. And it's just backlogged terribly. And again, it's not clear how the catching up will be done in any quick fashion.
Rosalie, could you give us your characterization of the significance of those numbers?
Certainly. Really, I think that the number of people waiting or tests that we haven't done sort of speaks for itself for this size. But what I'm more concerned about, and sort of echoing Andre, is that those numbers don't include the considerations for, do we have the capacity, do we have the staff to actually be able to deal with the backlog in the time that the FAO is projecting, because they're assuming that hospitals can operate above capacity for that entire period. And we're thinking about 3 years. So my worry is that all of that delayed diagnostics will actually mean that once we do get to diagnosis and people reach treatment, their case might be more complex, which could come with health consequences for the patients, but also increased costs for the healthcare system. And so I suppose, though that number is somewhat alarming as it is, my worry is actually that it might be too optimistic in terms of how quickly we'll be able to deal with the backlog, and that it might not include added costs because we've not found something during that backlog.
Well, that raises an interesting question because, okay, Sheila, Peter Weltman, the Financial Accountability Officer, in my interview with him just before you guys came on, said that essentially the province is going to have to double the current spending it currently budgets in order to clear that backlog. Rosalie raises the issue that even if they did that, do we have enough doctors? Do we have enough nurses? Do we have enough OR capacity? Do we have enough diagnostic tools to be able to do it anyway? What can you tell us on that?
Well, I think there are a number of ways in which we can start to address this. One of which is we have internationally educated healthcare providers that we could, fast track into service in this kind of situation. And we have to really take a hard look and see what capital expenditures would need to be made, what kinds of investments do we need to make in more healthcare providers. And I think we really have to look at what we have done during the pandemic and step up in the same kinds of ways that we stepped up then. And I really think that we have faced decades of underinvestment in healthcare in Ontario. And as a result, the chickens are coming home to roost here. And I think we really have to take a hard look at what we need in the healthcare system and how we're going to pay for it.
That's just some of what we covered this week on the agenda. For more, including the full conversations, you can visit our website, tvo.org, our YouTube channel at youtube.com/theagenda, or our Twitter feed, twitter.com/theagenda. And that's it for this Friday, May 21st, 2021. On Monday, because of the long holiday weekend, we will be airing the TVO original, a slow documentary, Tripping the Niagara. It's an amazing bird's eye view of the region from the areas, wineries to the iconic falls. And we'll return on Tuesday with a conversation with a notorious anonymous hacktivist, Commander X. I'm Nam Kiwanuka. Thank you for watching TVO and for joining us online at tvo.org. Have a great long weekend, and Steve will see you on Tuesday.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism. Ontario Hubs are made possible by the Barry and Laurie Green Family Charitable Trust and Goldie Feldman.